Hi, I'm Randy Burkholder.
And I'm Ann Bonner. We're respiratory therapists here at Southwest Health Center.
And we are also sleep technologists. We are here to help you with all aspects of your sleep.
So let's go into the sleep lab and see what it looks like. So before you come in for your sleep study, we'll be sending you a packet of information, and in there will be the time that you need to arrive at the facility, what you need to bring with you, and kind of the do's and don'ts of what you should do the day of your study. Things like don't take a nap, try to limit your caffeine intake that day, and always a good idea to bring a favorite pillow or things like that if something that helps you sleep better. In the packet of information that we'll be sending you is a patient data sheet, and on there you'll be able to give us a little bit more information about the quality of your sleep, times you go to bed, and we'll ask you to fill that out and send it back to us before your sleep study. Once you arrive at the facility for the night of your sleep study, you'll come in through the emergency room entrance. You'll register, and then the sleep tech will come down and greet you, and we'll bring you upstairs to the sleep room. Once upstairs, we'll sit and chat a little bit about your patient data sheet so we have a little bit better understanding of your sleep, and we'll go through the specifics of things that you'll see in the lab and what we'll be doing for your sleep study that night. We will let you try the CPAP mask on so you can see what that's going to feel like. If we're going to need to use the CPAP, you'll have an exposure to that so you'll know what it feels like before that's put on in the middle of the night. Your sleep study involves being hooked up to a variety of different equipment, starting from your head all the way down to your legs. We start up here with your head. The electrodes on your head will let us know your sleep patterns as far as your brainwave goes, when you're awake and when you're asleep, and the different stages of sleep that you can be in. We'll put some things on your eyes to see if when you're in dream state. We'll put some things on your chin. We'll put a microphone on your voice box, so if you snore we can hear that. We'll monitor your oxygen level, your heart. We'll also put a belt around your chest and your stomach to let us see your breathing efforts, and we'll also put some electrodes on your legs to see if we monitor for restless leg syndrome as well. So you'll be hooked up with a variety of equipment, but it's all meant to move with you as you sleep. So if you naturally toss and turn a lot in your sleep, the equipment is meant to move with you so you don't have to worry about it falling off.
When you come into the room, you'll be a private room. You have it all to yourself. You have your own private bath. So the next day, if you would like to take a shower, we will have soap, shampoo, and towels available for you. The night of your study, after we get all the hookups, does not necessarily mean you have to go to sleep right away. If you want to just sit and unwind, watch TV for a while, watch the news, the late show, whatever, that is fine. We do like to have the lights off by 11:30 that night, just so we can get the study going.
People often worry when they come to a sleep lab if they're going to be able to sleep. It's a different environment, a different bed. But the bed here is very comfortable. Most people will tell us that they sleep very well. The room is very dark with darkened shades, as well as we can control the temperature for you. If you like it cool or warm, we even have a fan we can put in the room. Anything that we can do to make the room as comfortable for you during your sleep as we can, we try to do.
If you feel you are going to have a restless night because of the wires, your physician has ordered that we can give you some type of Ambien, which is to help you relax, to get you to sleep. If you would need anything in the middle of the night, you would call out the sleep technician's name. We would come in to see what you would need, and basically if you would need to get up to move around, all we have to do is just disconnect 2 cables. So don't hesitate. If you need anything, to call us in here. We're here to help you.
Many people wonder how long they have to be in the sleep lab, and usually what we try to do is, your testing is usually done between about 5:30 and 6:30 in the morning, and we kind of wait till you're in a kind of almost awake stage, and we'll come in and discontinue your test at that point in time, but you don't have to leave it then. If you'd like to relax, maybe watch a little TV, breakfast is available, or they can bring breakfast up to you anytime after 6 o'clock, and you can order anything you'd like. They usually will bring you a newspaper as well, so you can stay in the morning. But if you conversely have to be up at a certain time because you need to get to work or your children, just let the technician know the night before, and we can make sure that you're up in time to be out of the lab at a certain time if you need to be. After your test is over, your information will go to a sleep specialist for interpretation. And usually we tell people it can be about a week or two before they can have results back to their primary care physician. Their primary care physician will always get a copy of the sleep specialist's interpretation. If you end up needing to go on CPAP, we will help you facilitate getting a company selected and get all the information to that home care company so we can get you started on your treatment as soon as possible. If you would like to, you can certainly see a sleep specialist after your test is over to go through the information with you, or you can talk to your primary care physician who would also have a copy of your test results. Thank you for touring our sleep lab. If you have any questions regarding a sleep study or the sleep center here at Southwest Health Center, don't hesitate to give us a call at 342-4757.